there. Good morning.
Good morning.
My name is Amanda Robertson, and I will be the nurse practitioner in the office today taking care of you. And so welcome to Bradley Primary Care. I will be taking some notes today during our visit just to get a thorough history and document all the assessment findings and everything like that. Before we get started, are you okay if I close the door for some privacy? Yeah. All right. Okay, and then just want to kind of get to know you a little bit, and you kind of tell me what you do for a living. Are you in school, or what is your situation?
I'm in school. I'm homeschooled. It's kind of like through a high school, but it's a PLO program.
Okay.
And I work at Olive Garden as a server in Cleveland.
Okay, so you're pretty much on your feet a lot
Yes.
at work and running.
Yes.
Okay. All right. Very important to have some good shoes
Oh, yeah.
on board, so that's good. All right. You look like you have some good posture there, and you don't walk with a cane or a walker or nothing like that. Okay. At home, are you able to do like all of your own stuff, like give yourself a bath, dress yourself, all the activities of daily living?
Yes.
All right. Good. Okay. I see that you're wearing glasses. Do you see well out of them?
Not out of them, but I see a lot better with them.
Okay, but I mean, out of the lenses,
yes,
you see good.
yes, sorry,
okay,
yes.
no, you're fine. I'm just making sure. And you hear everything okay?
Yes.
All right, good. And then I saw that they measured you outside,
Yes.
and you were 5'2", and it
Yes.
looks like 110 pounds.
Yes.
So I'm going to be doing a full set of vitals on you. We will do a full head to toe, and I'll kind of walk you through it and tell you what we're doing.
Okay.
But I wanted to tell you your height and weight. That puts your BMI. I was calculating that on here, and it is at 20.1, which is a perfect healthy weight.
Okay.
So that is very good there, and you look well nourished, and that's a good thing. All right, so I'm gonna go ahead and wash my hands.
Okay.
And put on some gloves, and then I am going to start with your vital signs, okay? All right. We will start off first with the temperature, and we'll get an oral temp.
Do you want it under the tongue?
Yes,
Okay.
under your tongue for me. There you go. All right, 98.2. Sometimes these can take forever, and that one little minute that it's taken to do it feels like an eternity. All right, I'm going to write that down. Okay, and then I am going to check your, this is called a pulse ox machine, and it's just, it does not. And sometimes that can be affected, like if your hands are too cold or too hot. Yours seem like they're just fine, so that shouldn't be an issue. All right, and I'm going to check your pulse on this wrist, just to make sure it's kind of correlating with what we're seeing there, okay? And I will time that. Perfect. And you're at 80. So 80 beats per minute. That's normal. We like 60 to 100. All right. 97% oxygen saturation on room air. So that is good. And that just means you're not on any oxygen. So that's a good thing. Yeah, that's a good thing. All right, and then now I'm going to go ahead and get your blood pressure. Are you right or left-handed?
I'm right-handed.
Right-handed? Okay. All right.
My shirt pulled up.
Yeah, we'll pull it up just a little bit there.
You want my arm down?
Yes, rest it on your leg. All right. It was 122/70. That is perfect. All right. So now with our assessment, I am going to start, we're going to start with your head and kind of work down. I'll examine your face. We'll look into the ears, your lymph nodes and everything. And I'll kind of give you, like I said, a walk-by of what we're doing. If you want to take off your glasses just for this part, because I don't want to end up accidentally knocking them off, okay? All right. And then we'll also assess some facial expressions, some cranial nerves, and just make sure all of that is normal, okay? So first I'm just going to inspect. I'm just kind of looking at your hair. Definitely looks like you have some thick, normal texture, so that is great. It is, are you naturally curly?
Yes.
It is very beautiful. I like the natural curls. I don't see, we always look for any flaking, like it could be dandruff or eczema or like psoriasis. And I don't see any infestations, like any lice or anything that doesn't belong in there, okay?
Good.
All right, so now I'm going to feel of your head, and I just want you to tell me, like, if you are tender in any spots that I'm feeling. I'm just kind of rubbing all over to make sure there's no lumps, lesions, any redness, swelling, anything like that. Are you having any tenderness in any of those areas?
No, ma'am.
Perfect. Okay. And then while I'm here, I'm going to go ahead and feel for lymph nodes, any tenderness or soreness in any of these areas.
No, ma'am.
Okay. I'm going to feel your temporal pulses while I'm here. Okay. And then I'm also going to feel sinuses. Any tenderness noted there?
No, ma'am.
Okay. And I see, it's a good thing you're a girl. You should not have facial hair. I don't see any facial hair. I think we all have a little peach fuzz. But no facial hair. I don't see, any lesions or any redness, swelling, no puffy eyes. Your eyebrows are evenly distributed. Everything is within the limits I would expect it to be in. Okay. So I'm going to write that down, just that everything's good. I feel like your head's normal cephalic, which means a normal shape. We call atraumatic. There's no injuries. There's no, lesions or anything, masses, anything we're worried about. Okay, so that's all good. Then you didn't have any tenderness. That's normal as well. So now to assess some of the cranial nerves, what I want you to do is clench your teeth for me. Like, there you go. And then I want you to wrinkle up your forehead. All right, close your eyes, and I'm going to try to put some resistance. There you go. All right, smile showing your teeth. All right, perfect. Stick your tongue out for me. Move your tongue side to side for me. Okay, perfect. Very good. All right, and that just tells me that your cranial nerves 7 and 12 are intact. All your, parts are working like they should. Okay. All right. Now I'm going to do a little bit of it's like a light touch test. Okay. And I want you to just tell me, I'll tell you the side, I want you to just tell me where you're feeling it, if you are feeling me touch you. Okay? And it's not a trick by any means. I just want to make sure both sides are equal. Okay? Tell me where you feel that.
My left side.
Okay?
Right side.
All right.
Left side. Left side.
Okay.
Right side. Right side.
Okay. And that tells me forehead, cheeks, and chin, you have your light sensations intact, and all of that is within normal limits, okay? All right. Now, you didn't have any tenderness in your sinuses, so you don't have any allergy trouble or any sinus issues. Wonderful. Okay? Because most of the time when people do, they're really tender right through here. Sometimes with the pollen count in Tennessee, that happens, okay? All right, we are going to do visual fields. We're going to check your vision in a couple different ways. We're going to have a whole thing with your eyes.
Okay. Do you want my glasses on or off?
Right now, you can put your glasses on. Because do you see a normal eye doctor?
Yes.
Okay, and when has been your last eye exam?
Maybe a month.
Okay, so a month ago
Yeah.
you saw an eye doctor? Oh, perfect. Okay. Any changes or any concerns that he was worried about with your visit? Okay, great. All right, so I am going to sit across from you here.
Okay.
Let me get my stool. And we're just going to go ahead and I'm going to have you just kind of cup one hand over, over one of your eyes. You're like a pro at this already. I want you to look straight ahead at my nose with that eye, okay? And I'm just going to check some fields of vision, and you tell me what number you see, because I'm going to hold up some fingers, okay? So.
1, 2, 2, 1.
Perfect. Okay, change the other side.
Oh my glasses
No,
are
I
foggy.
was going to say, you're making your glasses fog up.
I don't know if that's gonna help or not.
Okay. All right, you ready?
1, 2, 2, 1.
Perfect. All right. Okay, and so what we checked with that is our second cranial nerve, and that just tells me your cranial nerve 2 is intact.
Okay.
So that's a good thing. All right, now I'm going to go ahead while we've got the lights on, because there's a couple things I'm going to do with the lights dimmed down.
Okay.
I'm going to have you stand, and we're going to do the Snellen chart.
Okay.
And that chart, the first thing we did was vision by, it's a confrontation visual acuity. So then the Snellen chart tells us a more, definitive of what your vision is, like 20/20 or etc. So I'm going to have you stand. You'll be about 20 feet away from that chart. And I'm going to have you read the lowest number that you're able to on the diagram, okay?
Do you want my glasses on or off?
You can leave your glasses on since you have a vision provider and you just saw them. So I'm okay with that. Which one is the lowest line you're able to read?
D, E.
Okay, so line 8 right here?
Yes, sorry.
Okay, go ahead. No, you're
Okay.
fine. Go ahead on line 8.
D, E, F, P, O, T, E, C.
Perfect. All right, now cover your other eye. And which one's the lowest line on that you can read?
D, E, F, O, T, E, C.
Perfect. All right, so you are looking right now, because you are 20 feet away from the diagram, on the line you could read with your glasses, you are at 20/20 vision.
Okay.
So that is wonderful. All right, I'll have you take a seat, and then we are going to go ahead and I am going to check some light reflexes, okay? Before we dim the lights, remove your glasses for me. And I don't see, okay, so your conjunctiva is clear like it should be. Your sclera, which is like the white of your eye, it is white. I would be concerned if it were like yellow or if it was pink. Have you ever had pink eye?
No.
Okay. So, you would know it's
Okay.
itching, burning, and the sclera is discolored. So all of yours look good. Your eyes are brown. Very pretty.
Thanks.
Okay, so we will turn down the lights. And the first thing I'm going to do is I am going to look at you with a pen light, okay? And I've measured your pupil size, and your pupils are both a 3, okay? That's just the size of the pupils that I'm using on my pen light, okay? We're going to check first for accommodation. So I'm going to just have the pen light to your nose. You just look straight ahead. Actually, let me have you do this. Look at something on the wall and kind of focus on a spot on the wall, okay? Perfect. Okay. And then have you look at my nose right here. Just keep your eye on my nose. Awesome. Okay. Same thing for this side. Perfect. So that tells me your pupils are equal. They're reacting. They're reactive to light. They're round and reactive to light and accommodation. That means they like get big and then get small again. Okay, just like they're supposed to. Now I'm going to look at the inside of your eye. I'm going to go ahead and look at like the red light reflex. I'm going to look at your optic nerve, all of those things that I can see from the outside. Okay, so I'm going to go from my right to your right eye, but I'll have my hand on your shoulder so you don't think I'm going to like accidentally bump into you because it is kind of dim. Okay. All right. So I'm going to check that out, and I'm just going to write down where you were symmetrical and all that was good. Okay. And we've got your glasses off. So what we're wanting is we want the red reflex to be present. I want to be able to see that. I don't want to see any like hemorrhaging or bleeding or anything in there. Everything just normal. Okay. And I will, of course, let you know if I see anything, okay?
Just look straight.
I want you to look straight ahead, yes. And then towards the very end, I will have you look into the light.
Okay.
But yes, I do want you to just look straight ahead for me. Again, my hand's on your shoulder. Okay. It's okay. It's okay. All right. Perfect. Perfect. Okay. All right. Now you're going to see me come in from the other side. Again, my hand on your shoulder. All right. Now have you look straight at the light. Straight at the light. All right, sweetheart. Everything there is normal, so that is good. All right. I believe we are done. I did not see any hemorrhages. Your macula was intact. Retinal vessels were all normal. So those are all good things, okay? And I'm sure your eye doctor did a little more thorough than that, so I'm not concerned there, okay? Now, we are going to go to the ears. I'll have, we'll turn the lights back up. Sorry, we have to turn them all the way dark for a minute, and then we turn them back up. Okay. All right. First, I have already checked like your lymph nodes. Those were good. I didn't feel any swelling, enlargement. You didn't complain of any tenderness, so that's good. I'm going to look at your external ears and just take a look at them and see if I see anything. Sometimes people have like dry skin or there may be drainage if there's a problem or anything. So I'm just going to take a look at that. And I don't see any lesions, no bumps, no drainage, no dry skin, nothing. All that looks normal. So now I'm going to go ahead and look inside your ears. What I'm looking for is I'm visualizing the tympanic membrane. We want it to be like a gray, like intact, pearly gray color. And that just tells us everything's normal with the ear. Normally, if there's any kind of fluid or anything behind it, we can see that by looking, okay? We can also see wax. So, and I'm sure you probably know, everybody warns against Q-tips. Those can kind of cause the earwax to be more impacted. So if you ever notice that you do use Q-tips a lot and you can't hear as well as you used to, let me know and we can kind of check it out, okay? All right, so I'm going to pull your ear up and back as I'm looking, okay? And I'm looking at the inside, at the canal. And then I'm going to look back there at your tympanic membrane. All right. And I do see a little bit of wax. There's nothing blocking my view. I can see your tympanic membrane. It looks perfect. So you're doing a good job there. All right. Up and back. Okay, that one does have a little more wax in it. I can give you some Debrox, some wax removal gel eardrops. You put them in your ear, put a cotton ball in, and then it'll help wash that out, okay? But nothing that's blocking anything. Everything else looks healthy, so that is perfect. Okay, so now, so you had pearly gray, all the good things. I saw nothing on the external ear. We are going to check, I am going to look at checking out your hearing, okay? Does your mom ever tell you that you're not listening and you can't hear? Sometimes? Okay. Okay, well now this is going to be the true test and we'll have to tell her the truth, okay? All right, so I'm going to go behind you. And what we're going to do first is called a whisper test. Okay. I am going to stand where, the reason I'm behind you is because I don't want you to be able to read my lips, okay? So I'm going to whisper something into one ear, and I want you to repeat it out loud, and then I'm going to whisper something in your other, and you tell me what I said, okay? All right. You ready?
Yes. 1, 2, 3.
Perfect.
5, 6, 7.
Perfect. Okay. Now, we are going to do 2 other hearing tests that involve this lovely tuning fork, okay?
Okay.
So, I'm going to hit it, and then I will have it like parallel to your ear, and then I will have it up here to the bone, conduction. You tell me which one you hear best, if it's spot A or spot B, okay? And I will do that for both ears,
Okay.
all right? Okay, which one did you hear it better in?
A.
An A, okay. We're going to do the other side. A or B?
A.
All right. Okay, and then one more. I want you to tell me, do you hear it on the left side, the right side, or right in the middle, okay?
Okay. The middle.
Perfect. All right, that tells me your hearing is normal and that is all good. Okay, and then now we are going to go to your nose. You're going to feel a little weird because I'm going to be looking in your nose.
Okay.
So don't worry if you have any boogers or anything. I've seen a couple, so it's all right.
Do you need my glasses off?
No, I think your glasses will be okay. I might have you tilt your head just a little so I can look up each nostril. But it does look like, okay, so you have a septum piercing, but
Yes.
your septum is midline like
Okay.
it's supposed to be. I don't see any deformities. I don't see any lesions or
Okay.
anything in the nose. So all that looks good, okay? Do you have any trouble with your nose or anything that you know of? Okay. And then let me just do a light. Okay. Perfect. All right. And now I'm going to do like a smell test.
Okay.
I have a scent of a candle. And of course, you don't know what scent it is,
Yes.
but it's a common everyday, you would know if you smelled it kind of
Okay.
thing. So I'm going to have you smell that for me and tell me what scent that you think that is.
Vanilla.
That's right. Vanilla's pretty common. So I figured that was a pretty easy one to go with.
Yes.
Okay, now I'm going to look into your mouth. I'm going to check teeth. Do you see a dentist
Yes.
regularly? Okay. Make sure you get your cleanings twice a year. Try to brush and floss every
Yes.
day. At least twice a day on the
Yes.
brushing. Once a day for the flossing. You know, that's good. Okay, so I'm going to look at gums, teeth, tonsils, the cheeks of your, inside your cheeks, all of the things, just to make sure everything looks normal, okay? So just open up. Okay, your teeth look good. Ever have braces or anything like that? Okay, go like this. Perfect. Okay, I'm going to stick this tongue depressor on your tongue, have you kind of stick it out and open your mouth, and I'm going to have you, when I'm ready, there you go, say, ah. Perfect. So you still have your tonsils, but they look like healthy tonsils, so that's a good thing. No exudate on the tonsils. They're normal, normal. I don't see anything abnormal in your mouth. I don't see any bite marks in your cheeks, anything like that. No bleeding gums, nothing like that. Okay, so those are all good. Your dentist will be proud of you.
Thanks.
Okay. All right, now we are going to go to the neck.
Okay.
So with the neck, what we're going to look at is I'm checking like you have a jugular vein in your neck. I'm making sure that's not, prominent and I can see it. I shouldn't be able to. Okay. I'm going to check your trachea, make sure it's all midline and lining up. Thyroid, I'm going to go behind you and palpate on your neck. I should not feel your thyroid.
Okay.
I should be able to assess everything, and the only time I would feel your thyroid is if there was an issue, okay? So what I'm going to do, I know we've already felt here some, but I am going to go ahead and check out the trachea. And that is midline. That is very good there, okay? And then I'm going to have you chin to your chest, okay? And then I'm going to have you straight out and then lean back for me. Perfect, okay? Can you swallow?
Ooh.
Oh, I know. Was your
It's
mouth
all
dry?
hard.
Okay. And then I'm going to get behind you and palpate all through here just to make sure we're not seeing anything with the thyroid, okay? All right, one more time. I do want you to swallow for me, okay? Perfect. And everything feels normal there. I don't feel any abnormalities or anything I'm concerned about, okay?
Okay.
All right. Also with your head, just to visualize all the things, have you turned that to that side? Okay, perfect. Okay, turn to this. All right. And then I want you to kind of lean shoulder to shoulder for me. Okay. Everything's symmetrical on both sides. Everything looks great there, okay? All right. So far, so good.
That's good.
Okay. And the leaning side to side, chin to chest, and leaning back, that kind of shows me your range of motion with your neck and how flexible it is. And you've got good movement. It's symmetrical, which means it's on both sides. So there's no concerns there. So now we're going to go down and we're going to kind of look at your chest.
Okay.
So we're going to look at the lungs, the heart, all of that, okay? So when I first look at you here, I'm going to kind of take a look, inspection. I don't see any lumps, lesions, anything that I would be concerned with in the chest portion, okay? And then I'm going to have you lay down for me. Well, before I have you lay down, I'm going to take a listen to you, okay? I'm going to listen to your lungs on the front side, and then I'm going to listen to your heart, and then we're going to listen on the back, okay? So just breathe normal right now. I'm just going to listen to the heart, okay? Okay. Take a good deep breath for me. Let it out. Very good. Good deep breath. Let it out. A good deep breath. Let it out. Good deep breath. And let it out. Perfect. All right. I'm also going to listen to your carotid arteries right here. Just want to make sure you don't have any bruits or any abnormal sounds. Your heart sounds good. I did not hear any murmurs, anything that would make me think that you've got a weird sound going on. The front part, I did not hear any wheezes, crackles, anything in your lungs. They sound good and clear. And you're moving air good. All right, so I'm going to listen to your carotid here. I'm going to have you just breathe normal. All right, now hold your breath for just a second. Okay, you can breathe. Perfect. All right, just breathe normal. Hold your breath for just a second. Go ahead and breathe. Perfect. All right, I'm going to listen to your lungs from the back side. Take a good deep breath for me. Let it out. Good deep breath. Let it out. Again. Let it out. Good deep breath. Let it out. Good deep breath. Let it out. And one more time. Let it out. Very good. You're good and clear throughout. Are you having any cough or congestion or anything that you've noticed?
Nope.
Perfect. Okay. And then what I will do is I am going to go ahead and check the back side for any firmness. I'm going to have you just make sure I feel the same vibration throughout.
Okay.
And I'm also going to assess for any tenderness back here. Okay, so I'm going to palpate your back here. Okay, I want you to say 9, 9.
9, 9.
Okay, say it again.
9, 9.
Perfect. Any tenderness here?
Nope.
Okay, perfect. All right, I'm going to have you lay down for me on the table. I'm going to go ahead and I'm going to palpate. And I did notice, like, your diameter, your anterior is smaller than your lateral, which is normal. If not, you may have, like, you know, the men sometimes that have, like, the beer bellies or, like, the bigger chest. Yours is perfectly normal, okay? All right, so what I'm going to do now, let me write your results for that, and then we listen to your lungs, and those are clear. Your heart sounds great. I am going to find, I'm going to show you where I listen, and then right here, when I listen there, that's like your point of maximum impulse, okay? So I listened to that. All of that sounds good. I am going, we assess your belly a little different.
Okay.
So I'm going to go ahead and palpate your chest and just palpate and percuss and make sure I don't hear any abnormal sounds or feel anything abnormal. So with percussion, normally over the cardiac frame, we hear just a dullness. Okay? And then when we palpate, there shouldn't be anything abnormal, nothing painful. Okay? And I don't feel anything that isn't normal to me. So that is good. And I'm hearing all the sounds I should, okay? So that is good. Okay. Now, with the stomach, those are a little bit different because with the abdomen, you have to do a little different because if you started pushing around on your belly, you can be making all kinds of crazy sounds and all the things. So with the belly, I'm gonna look at you there, and I don't see any scars, any bruising, any abnormalities. So I've inspected it. I'm gonna listen to it first before I palpate it or do anything else, okay? All right, you have good bowel sounds. Are you having normal bowel movements?
Yes.
All right, so no issues with constipation or diarrhea. Okay, now that we've inspected and auscultated, now I'm going to percuss on your belly. All right. And now I'm going to palpate, okay? And one of the other things that we do is we kind of look for any rebound tenderness. Like if I do this and let go, do you have any pain on this other side?
No.
Okay. And then there is a test to kind of check for your gallbladder. Okay. So I'm going to have you exhale, like blow out your breath. All right. Take a big deep breath in. All right. And then let it out. Any pain?
No.
Perfect. Okay. And that is a negative sign, and that's a good thing. Okay. If anybody ever asks you about that, you just tell them that is the Murphy sign, and you were negative for that. Okay. All right. So now I'm going to jot down your stuff from your abdominal. All right. And I did not see anything going on. I did not feel for any, I didn't feel any splenomegaly, which would be an enlarged spleen, no liver tenderness, nothing like that. So that was good. All of that's normal. Heard everything. The tympanic, it was tympanic through the percussion through the whole exam, and that's what we want to hear, okay? And then you wouldn't be tender when I was palpating. It's your right lower quadrant. You would be tender in those situations if you were having like an appendicitis or something like that, okay? And I didn't notice any of that with you with your exam, okay? And on your back, when I felt, you didn't have any CVA tenderness. So it doesn't indicate that you've got any kind of kidney infection or anything like that going on, because nothing there is alerting me to check that out further, okay? And then what we'll do now, and I didn't feel any enlargement, like I said, in spleen, kidneys, anything. So now we're going to go ahead and start looking at muscles, okay? And we are going to start, I'm going to have you go ahead and do a couple things for me here, okay? And I'm kind of a little backwards, but not all the way. Okay, so far, all your skin that I've inspected, warm, dry, intact. I don't have any worries. I don't see any lesions. There's not any wounds, nothing like that. All right. I'm going to check your fingers for capillary refill. All right. And I'm just looking at your nails. They're normal, no clubbing. Let me see the palm of your hands. Okay. I've checked pulses, and those are all good. And they're both 2+ bilaterally and they're equal. You have good capillary refill. I am going to check your lower extremity pulses as well. Femoral pulse is down here. That would be where we would check those. And then check back here behind your inner pulses there. All right, and then on top for your dorsus pedis. Perfect. Okay, now a couple things with range of motion. I want you to lift your feet up for me. Perfect. Now arch them down. Okay, one at a time, I want you to lift up your leg in the air. Perfect, and lower back down. Okay, do that with the same, and lower back down. All right, bring one knee up for me. There you go, and lay it back, and do the same with the other. One knee up, okay, and down. Okay, now with this one, I want you to take the heel of this and rub it up your shin. Okay, and then just back down, and then repeat on that side, and then rub it back down. Perfect. Okay, now on this, I want you to lay that leg out to the side. Perfect, and then move it back. Do the same with the other one. Okay, move it back. All right, now I want you to kind of bend this up and cross your knee. There you go. Kind of cross your leg over like that. Okay. And then down. And then I'll have you do your other one. Awesome.
Okay.
Yes.
Okay.
Yep. Okay. And then we're going to turn turn it out like that. And then out like that. All right. And let's do your other one. You can do it out first. Yep. And then in. Okay. And then we've already done your arms, the range of motion with those. So I'll have you sit up now.
You want me to face you again?
Yes, you can face me. And we did the carpal tunnel inspection on your hands. So you did great with all of that. We looked at your pulses. All your pulses were equal and bilateral. Your capillary refill was good. Now, we're going to test kind of the range of motion and strength on some of your extremities.
Okay.
So I am going to I want you to raise up your shoulders while I'm trying to push you down.
Okay.
Okay? All right, perfect. Okay? Both of my hands, I want you to squeeze. Okay? Awesome. Knees or legs, I want you to try to lift your thighs off of the table while I'm pushing down. Awesome. Okay, perfect. Okay, now we are going to, I did your flexion on that. I'm just trying to make sure we hit all of the highlights. Okay, so I'm going to make you work here in a minute, okay?
Okay.
All right, now we are going to do a couple of neurological things. I've already asked you like your name, date of birth, and all of that. We did light touch on like your forehead, your cheeks, and your chin. So we're going to do that. I'm going to do that on your arms, hands, legs, and feet, just to make sure you can feel that, okay? So you tell me where you feel this at.
You want me to say like bottom, top?
Just what body part you feel it
Okay.
on, okay? I want you looking straight ahead of the
Okay.
wall.
Sorry.
There, no, you're okay.
My arm.
Okay, which arm?
Left arm.
All right.
My hand. Left hand.
Okay.
Right hand. Right arm.
Perfect. Okay. And then let me, if you don't care, I'll have you prop up your leg here.
Like foot wise?
Yes,
Okay.
yes.
My legs may be a little hairy, sorry.
No, you're fine. You're fine. Okay.
Right foot.
Okay.
I had to think of my left and right.
That's okay.
Right leg.
All right. And then I'll see if you've got the good sensations over here.
Left leg.
Okay.
Left foot. Sorry.
Okay. No. You are fine. Okay. This is also going to this is like, I'm going to check your reflexes, but then I'm also going to see if you feel pain, like with the,
Okay.
you know what I mean? Like that kind of feels sharp. Do you feel like a little bit at the end? Okay. So I'm going to check some reflexes. Perfect. All right. Tell me where you feel that.
Like around my knee.
Okay.
On the left. And
All right.
Right around my knee.
All right. Okay, just kind of relax. No, you're fine. Just kind of relax. Okay. And then just kind of dangle. There you go. You got to hit right at the right spot there. All right. And these are like checking your deep tendon reflexes. Okay. And all of those are intact. They are 2+ and symmetrical, which is normal, and that's what we want to see with that, okay? Now, let me check your reflexes also with your Achilles down here. Okay. All right. Do you feel that?
Yes.
Or do you feel it?
My right foot, left foot.
Okay. And is that the sharp pain that we talked about? Okay. All right. Now, I'm going to have you stand for me.
Okay.
We're going to do, I'm going to observe your gait. I'm going to have you do a couple walking exercises, just walking differently. And then we're going to do one standing still that's called a Romberg's test, just to kind of assess your balance.
Okay.
So I'm going to move this table out of the way. I'm going to have you stand. All right. I'm going to have you go against that right there. And when you walk forward towards the front of that table, I want you to walk on your heels for me.
Okay.
Okay? And what I'm looking for is just making sure you have a straight, smooth gait. You're not drifting to one side or the other, anything like that, okay? So walk on your heels for me. Perfect. Okay? And when you turn around, walk back on your tiptoes for me. Okay? All right. Now, I will have you stand because I'm going to kind of look at your spine. Okay? And then I'll have you bend over and touch your toes for me. Perfect. No, I don't feel any kind of curvature. You've never been told you had scoliosis or anything like that? Okay, wonderful. All right, and then we are also, we are going to do, I'm going to have you kind of bend. Like you bend forward for me. How far back can you bend? Okay, perfect. I don't want you to fall. Don't fall on me. All right, now lean to one side for me.
Ooh.
Okay.
Sorry.
That's okay.
A little too far.
That's all right. Okay, perfect. All right, now we're going to do the Romberg test.
Okay.
So I'm going to have you have your arms down to your side for me, okay?
Okay.
Kind of have your feet a little bit apart. All right, get your bearings about you. Now, put your feet together. And while your eyes are open, I want you to just stand still and kind of look forward. All right, now I want you to close your eyes, and you're going to close your eyes for about 20 seconds, okay? All right. Okay, can you put your hands out in front of you? All right, close your eyes. All right, you can open them. Wonderful. Okay, you passed.
Hey.
All right. No, that is good. Okay, well, I will be honest, and you have, other than having to wear glasses, you've got a perfect physical exam. It was very nice to meet you, and you seem like you overall are well, well nourished. You appear well. You don't seem to be in poor health. Any concerns or anything today?
No, ma'am.
Anything I can do for you today?
No, ma'am.
All right. We'll plan a routine follow-up then in about 6 months. We'll draw some lab work just to kind of get a baseline, and we'll go from there. Okay. It was very nice to meet you. Thank you.
Yes, ma'am.